All right, welcome back again to the Empowerful Health Podcast. I'm Dr. Jeremy Kerrigan. Today I've got a very special guest, a very good friend of mine, been friends for many, many years, back before either of us were doctors. He went a different path. He is a medical doctor. He went to med school, same time I went to chiropractic school. We've stayed in touch. What's the right idea? We share a lot of ideas back and forth. So we're excited to share these ideas with you. So welcome, Stephen Merrell. Tell us a little bit about yourself today.
Thank you. So my name's Stephen Merrell. I'm from Virginia originally, born and raised, and I'm practicing out here in Utah. It's a wonderful, wonderful state, wonderful place to raise a family, and a great place to have a practice. I trained at the University of Virginia for medical school, and then came out here for residency training as a general practitioner. I'm a family physician, and really enjoy what I do. I love being one of the best point of contacts initially for the community to know what's going on with their body and how best to help their body to heal. And if it's something that I cannot do myself as a general practitioner, I love to be able to get them to a cardiologist or to a pulmonologist or whichever ologist it is that they need. And it's really rewarding to see children and to see those that are more mature in life and those that are still very immature in life.
So I love that. I love your background and how passionate you are. I want to ask you a question, and I didn't prep you for this. It came to mind. I remember hearing years ago that, doctors, there's a stigma around family practice medicine. Doctors are like, oh, no, don't go that direction. So would you elaborate a little bit on that? Like why there's a stigma and what you've gone against and how you've seen that's different, and then what you would say to other people that are considering that.
So great idea. So I went into medicine because when I was a child, I had a disease called Kawasaki's disease, and it wasn't a passion to drive motorcycles, though that is obviously its namesake. It was a viral vasculitis that left me with as a pretty sick child, and the potential of vessels around the heart dilating and then leading to heart attacks, heart disease, basically. And gratefully, my pediatrician, this is 38 years ago or so, diagnosed it appropriately, got me appropriate treatment. And I still remember doing the follow-up studies, and there was no problem with my heart at all. So it was really impactful in my life. And then as the son of a physician as well, my father was a well-respected plastic surgeon, helped get Operation Smile off the ground, and continue to work with them until the day he died. So wonderful man and very impactful to see how healthcare could change a person's life for the better. My dad in particular, when he would work overseas or help people with reconstructive surgeries, their life would go from, for example, individuals in Kenya where based on a facial malformation, they couldn't get a job because nobody would hire them because they just couldn't get jobs. And with a cleft lip, cleft palate repair or a 40-pound tumor that was relieved from a person's shoulder that had been there for 20 years, they get their life back. And so it was really impactful to see. So I was always interested in medicine, even as a child. Dad would come back from these trips with cool things, but amazing stories. And so I went into medicine thinking I'm going to be a pediatrician because I wanted to give back to, the community and catch that case of Kawasaki's disease and save a life.
Next kid
Exactly. Exactly. So I realized in medical school that if it was actually during my pediatric rotation, if I was going to be the most impactful for the kids, in my opinion, then I needed to be able to help the parents as well. When I was on my pediatric rotation, it was interesting to diagnose several viral illnesses and get the kids back home. And after they left, I was thinking, how cool would it be to have helped mom with her tobacco addiction or with her depression? Or can we help dad with his diabetes? Because clearly he's having a hard time with it. And so I had to broaden my scope of what I was willing to consider for a field. And internal medicine is very good. It's very, a lot of intelligent people end up in internal medicine and branch from there to cardiology or pulmonology or all the other ologies. For me, family medicine started to fit into place very well as it gives me the opportunity to help children, which was kind of my first love, but also help the parents. And it has continued to be very rewarding in that regard. So I love when I sit down with patients and I'm working with whatever the age group is, whether yesterday it was a 3-year-old and then a 17-year-old. And I take care of the mom as well. And then it was, the 93-year-old as well. So it's very rewarding.
We refer to that sometimes in chiropractic as womb to tomb.
Yes.
Care about them from mom being pregnant, which you do deliver babies, all the way to, shortly before they pass away, that type of thing. So.
Exactly. I actually, during family medicine rotation, my residency rather, I realized it was such an enjoyable part, the delivery side, that I did a fellowship. So I have a little bit more training and practice and experience so that I can help safely get babies here. And that's one of the only things I enjoy doing at 2:00 in the morning is helping.
Other than sleeping, right?
Exactly. It's sleep or help deliver a baby.
Right.
So it's been wonderful. So my career has been great as far as the choice of what to do in life. And I daily have the experience of helping individuals who are dealing with either emotional challenges or physical challenges. And my goal is to help them get to a better quality of life. And if I can't, then I can refer them to somebody who can. So I love being kind of that gatekeeper and that county doc, the good old county doc.
Who even still does house calls.
Yes.
We don't advertise that. Don't tell your friends. But you still been known to go to people's homes and treat and take care of them there.
Exactly.
And I think in our conversations over the years, one of the things that sets you apart and makes family practice more rewarding to you while it's frustrating to other people is that you take a look at the whole picture. It's not just come with your 5 problems, here's 5 pills that'll fix
exactly.
it, and you pass it on. You look at the whole thing, and you're talking about taking care of the whole family. There's value in that, and the habits mom and dad are creating are affecting the health of the kids, and the stress the kids experiencing is causing the parents issues.
Exactly.
As you take care and help all of them, you're making a bigger impact than just treating one person for one problem.
And that's why I think I was drawn to family medicine, and that's my hope and my prayer, frankly, is that I'm able to help patients as a family and as a family physician. So it's been very rewarding. The practice of medicine and healthcare in general is still very difficult, and I think that's part of what you were hoping we could talk a little bit about as well. And that's and I could spend forever on this, frankly. I got a master's of public health also during my training at the University of Virginia, and really appreciated the influence of the payment models on how healthcare is delivered. Am wanting desperately for there to be changes. Part of the challenge is knowing exactly how those changes will impact our day-to-day life, and what would be the solution for our healthcare challenges. I doubt in this podcast we'd be able to figure it out.
Right.
And partially because it's so multifactorial. There's so many different agencies and groups and desires and good ideas that go into the mix.
And going into this topic, that is a great topic. We could talk hours on that. I want to shift, the focus of the podcast is on people and how people can take control of their health. So when we're looking at models, the big question that I wanted to talk about with you is when people pay for their own care, in an affordable cash-based type practice, how does that impact their ability to get results? Have you seen this in practice? What's your observations? And I see a lot of people that call me up on the phone as a chiropractor. Hi, do you take insurance? This insurance, X, Y, and Z? No. How much is it? Okay, thank you. They hang up they're not willing to pay out of pocket.
Exactly.
But there are more and more people because it's hard to get into certain doctors. Doctors don't have enough time for them.
Yes.
They don't have the focus. So what's your perspective on this?
Great idea. I like the idea of primary care not requiring insurance companies in order to be processed. We don't typically go to a car mechanic and say, here's my insurance card. Would you please change the oil and put some gasoline in there and rotate the tires? Exactly. So the
Same
basics.
with our health insurance, we don't expect it to pay for gym memberships or smoothies or organic vegetables, this sort of thing. Right.
And so it'd be very nice if some of the basics weren't done through an insurance company because the cost of all of that goes up as soon as you include a third party. So I am very much interested and have attended conferences on a direct payment model, which is a cash-based one. And patients seem to be very satisfied with that because they're invested in their health more. And so they say this relationship is worth X amount and it's worth that to me. And then the physician's focus isn't so much on only when they're sick, but their focus is how do I keep these people as healthy as possible? And that is an empowering thing in and of itself for a practitioner to change from I'm only anticipating when they're sick, and when they're sick, I will bandage them back up and send them out, versus I'm trying to keep these X number of individuals as healthy as possible. So some of these docs will organize runs, so they'll organize walks. They have podcasts like this on how to live a healthy life. And so when individuals have put some skin in the game with either a membership fee that they're paying or a cash-based amount that they are providing, in general, they're wanting the advice that can help them lead to better health. And few things are as frustrating as a practitioner when I care more about the health of a patient than they do.
Absolutely.
And it makes it very, very difficult.
And to clarify on that, I've had the same experience, where when we say we care more about it, is that we're almost willing to do more for their health than they are.
Yes,
we
said.
Say, hey, you're having this problem. Here's a few things: exercises, diet, mental health types changes. Right. And then they come back month after month and they haven't done any of those things.
Right.
That's those types of frustration.
You're exactly right. My preference is to not pull out pills.
Right.
And so
which makes you quite unique in the realm. Well, at least from the perceptions, right?
Yes.
There's the stereotype, but that's, and people want that. They want the quick fix.
Exactly.
However, long-term results, that's not going to keep it there. Right?
Exactly. So it's much better to say, how can I help the body heal? And I will encourage patients to take a medication if their blood pressure is elevated and we're worried about a heart attack or a stroke in the time being. And if their diabetes is present or uncontrolled, then yes, there's a role for medication, but it goes right with did you know you can reverse diabetes? Did you know your blood pressure can be normal? Did you know that despite genetic predispositions, we can control many conditions based on what you're doing with your body and your life? The challenge is it's not typically encouraged in our Western society, especially in America. We reward things that are very quick. We reward things that don't take long. They're cheap, etc. And then we get back exactly what we've invested, which is more pills and a worse quality of life.
Right. I love something you said there. How can I help the body heal? If I hadn't already named the podcast, I think I might change it to that. That's a really great phrase. And that's a great phrase as individuals that people can consider. If you hear banging in the background, Steven's got 3 little kids, very full of energy. It's a lot of fun.
Are. And one of them is trying to reclaim the music room as his own.
That's just fun when we're talking about family practice, exactly. All ages to see this in the background. So. But that question is a great one for doctors to ask more. How can I help the body heal?
Yes.
Sometimes there's an ego in all professions, all healthcare providers, that I'm the healer. I'm going to fix the body. Well, the power that made the body heals the body.
Yes.
And the more we work with the body instead of fighting against it or telling it, no, you're stupid for throwing the blood pressure up. Let's just quiet it back down. Well, no, the body raised the blood pressure for a reason.
Exactly.
What's that reason? And a cash-based practice, when people are paying out of pocket, it does give, like you said, it reduces costs,
Right.
I tell people to think about it all the time. Like when they're paying in an insurance practice, they're paying you, the doctor, they're paying the front staff, they're paying your billing department.
Yep.
Then
marketing
on the
department.
Other side of the coin, in the insurance industry, they're paying the person filing the claim, the managers, the 6 levels of, leadership, all the way up to the CEO has to be paid every time you go in for a visit,
Right.
And so there's so much that goes into that when it's a cash practice, I tell patients, you pay me and that's it.
And
there's nothing else going on. I mean, I have my overhead, things like that, but it gives us as practitioners more time to focus and to be present with that person and really get in deep. And it's like, okay, you're having constant headaches. I can give you a pill for that, but let's look at spinal alignment,
Exactly.
And you refer to a good chiropractic friend of mine for things like that. But at the same time, it's like, well, let's look at what else,
Right. Let's look at the hydrations, look at what emotional health,
life.
Exactly. What's the sleep patterns? Are you exercising? Like, what are the nutritional things you're doing? We've even had a discovery just within my own family where my wife, who has been dealing with a gastric issue for many years, we connected her to, I think, the second allergist and discovered not a true allergy, just an intolerance to fructose. And it's been life-changing to be able to say, oh, this is the reason why you're dealing with this issue. And so it's really enjoyable to keep looking for those answers. But obviously there's a vested interest for my wife, but I try to also offer that for patients to say, I'm here to be with you until we figure this out.
One of my favorite experiences with this, I had a lady, and she'd been responding to chiropractic for a while. She'd gotten great results with care in the office, and then at one point she wasn't holding her adjustments as well. They wouldn't last as long. She wasn't feeling as good, and she came in very frustrated with me one day, and she was looking at me and she's like, why is this not staying? And I said, well, tell me what's going on in life.
Yeah.
Was there extra stress? That's one of the number one things in my practice I see is stress levels, And she looks at me and she goes, would stress be affecting this? And then she stopped. She didn't even let me answer. She rolls her eyes. She was a family practitioner, like a therapist. And so she deals with people in stress all the time, tells them how it affects their health in other ways. But when it came to like seeing it in her own self, she's like, oh yeah, this is why I'm not holding my adjustments.
Exactly.
And it was like, it was a big light bulb moment for her. But even as doctors, we sometimes get stuck not thinking clearly. But I love that example because it shows like in practice, when someone's having an issue, it's not always, and it's almost rarely just one thing.
Exactly.
There's usually 6 or 7 things that built up. And until we address all of them, they're not going to achieve their maximum health. Or like you were talking about, this practice of healthcare where it's not disease focused,
right?
It's health focused.
Exactly.
We don't have a healthcare system in our country. We have a sick care system.
Yeah, that's better said.
Have you had the experience as I have where people come in? I'm like, oh, I'm healthy, and then you do their history, and you're like, like you have 18 different things wrong with you. You're not healthy. You're just, it's not stopping you from doing anything.
Right.
Therefore, you're not thinking about it.
But you give it 10 years, you give it 20 years, and then you try picking up the pieces and you say, these are built over years worth of habits. I do like what you said about looking for the root cause of various conditions. When a patient comes in and they say, I'm experiencing dizziness, or I'm experiencing abdominal pain, or I'm experiencing headaches, for example, I like to draw a circle as if it's a pie and then draw a line through the middle and maybe divide it into quarters or into eighths or something, and then start to identify what are potentials behind the conditions that they're experiencing. And rarely, as you mentioned, is it one condition. It normally is several that come together, and then a patient experiences headaches that are so bad, it's just disruptive of life.
Right.
So it's really rewarding to say, okay, let's talk about stress. Let's talk about your sleeping patterns. Let's talk about your diet. Let's talk about nutrition. Let's talk about migraines. Like, what are they? And I wish we didn't have a condition just called migraines. And let's talk about like any other medicines that you're taking that lead to that. Let's talk about the blood pressure. And yes, I know it's a little bit high right now because you're sitting down with me for the first time, is what I tell patients. However, if it's always a little bit elevated, it's going to end up giving you a headache. And so it's really enjoyable to approach that in a kind of multi-pronged way.
Well, and as a patient, when we're all patients, I see multiple doctors, including yourself. You do some telemedicine with me and help me with some health issues. But as patients, like one of the things you hit on there that I wanted to kind of highlight a little bit was you wish there wasn't just a migraine diagnosis. And I think this is a big thing. And I see it as a chiropractor, and I'm sure you see it as medicine. I call them like dump diagnoses, where we just dump a whole bunch in there.
Totally.
And if you're dealing with one of these diagnoses, another one is fibromyalgia,
postural
sciatica.
Exactly.
That's a big thing. Autoimmune. There's just quite a few where there's so many facets, and even mental health, like anxiety. Right. I was talking to someone recently about anxiety, and we're going to do a whole separate episode on mental health because Stephen and I have a lot to say about this topic. But he was describing like, this is what anxiety is. And I wanted to throw out just 2 words, to you, right? His experience with it.
Yes.
And it's such a broad condition that there's so many different ways to experience it. And so as we're like experiencing something or we've been given a diagnosis, I try to encourage people not to hold on to it too tight.
Exactly.
Because there could be a lot of causes, like you said, with the pie chart. I love that. Like, you sit down and like
literally,
show
I
that
write
with
it,
people.
I draw it out, and then I say, and it's empowering also to be able to say, look, a portion of this is genetic, and you can't change that. You can't change your genetic material. I had a patient yesterday who was like, well, we might get there. And I was like, that's great. That's sci-fi. We might get there at some point.
We can talk about epigenetics at some point.
Exactly.
But yes.
But at least what I give them a little bit of a safety zone, because all of us inherit things from our progenitors or rather from our ancestors, that at some point, like, you can be doing everything right. And I don't want people to feel defeated when they're 65 and they need a blood pressure medication because they've done everything else that they can. I want them to take a low dose of a blood pressure medicine so that they continue to have a good quality of life for the next 20 years.
Right.
And so if we want our life expectancy to be good, and if we want the quality of our life to be good, we may need to lean on the best that we have in both Western, Eastern, and every kind of medicine.
Absolutely. Well, and like you said, after they've tried a lot of other stuff,
Yes.
and looked at the whole picture, and I'll look at a spine on an x-ray and see 65, 70 years worth of wear and tear.
Right.
I tell you're not 21 anymore. I can't get you back to that point. We may need to incorporate other things to help you live the life you want.
Exactly.
And go from there. Or as a patient who's had 7 spinal surgeries, we try to be realistic and say, okay, we're not going to fix all of this because there's so much going on. What can we do to improve your quality of life?
Exactly.
How can we work together?
Right. I agree. And so so much is, I think, in the hands of patients, and they really can have a better quality of life. I try within my patients as well to say, look, you're captain of the ship. I'm first mate. I've charted these waters before. But unless you're demanding some controlled substance that I don't agree with, then by and large, you get to dictate what happens. So it's my job to educate you on what the playing field looks like and what things to look out for. And so I spend, my staff will say, too much time with my patients, which often gets me behind and things, but it's really rewarding when patients understand the concerns that I have and the concerns that they brought to me, potential solutions, and then are actively involved in the solution creation. And that's why I think patients get better, because it's not a quick visit. Hi, here, you've got blood pressure elevation. Here's your pill. But it's, let's talk about hypertension. Let's talk about how we can address this in non-pharmacologic ways. And patients appreciate that.
Absolutely. Which at this point, I don't think you can even take new patients because people come from all over the place to see you because
That's very true.
You listen, which is a big, big difference, And when I tell people to look for healthcare practices, it's usually smaller ones where they have more time to listen, because as companies get bigger, and we won't say where, but you've worked in bigger clinics in the past.
Yes.
And it becomes more corporate, and there's quotas and a number of people you have to see to cover all the overhead and all the expenses. And it just takes away from that ability to focus on the person in front of you and truly help impact their health. And that's where real change is going to come, So as people are looking for doctors to go see, and honestly, finding a good family care doctor is one of the hardest things to do. I can appreciate in that. My area in Arizona, I don't have any I can recommend, And so finding one is looking for small clinics, looking for people that take time.
Yes.
And in Arizona, we have a lot of naturopathic medical doctors.
Yes.
So they have similar things. They can't prescribe like narcotics, but they can prescribe certain drugs. They can do a lot of basic care. And so more and more people are turning to that, paying out of pocket for care because they're going to get better results.
Exactly.
They're going to see long-term changes and actually have someone listen to them, hear their problems, and give them real solutions versus just, here's a pill you'll have to take for the rest of your life.
Yes, it's very difficult how corporate has changed the field of medicine. And if you're coming to me for a narcotic, you're going to be disappointed because I generally say if you've been hit by a bus or had major surgery, those are the two conditions where they actually have some evidence. Everything else is not really good medicine.
Well, appreciate you coming on today. This is a great topic. Obviously, we could go more and more in depth. We're, over 20 minutes now, but this is a things to be thinking about for people. And I love that there are practitioners in the world like you that are thinking differently and being there. And, I think there's more and more of them. We just hear about the not so great cases. And the more we look at it, the more people feel like they have control. And I love your example of they're the captain, you're the first officer. I always tell them that they're in charge. I'm just a tool, which, has funny meanings too, but I'm a tool they use to get where they want to go. They come see me for advice, for adjustments. And it's with you too. They come for recommendations, but ultimately they spend the vast majority of their lives outside of our practices. Exactly. They need tools so that they can take charge and live their best health. And it's really cool. I'm sure you've seen lots of rewarding examples. Does one come to mind that you want to close this podcast with today? Great thought. So I just had a patient yesterday, actually, who I sat down with him about a year ago, probably in his mid-30s, and has talked about how
His wife is concerned about his blood pressure, and it is elevated now, and he's gained some weight and things like that. And we had a somewhat heart-to-heart conversation last year about how physical activity, and if you were to drop 20 pounds on the bench and then walk away, you probably wouldn't have the blood pressure elevation. And can we help address the stress? And he's totally grabbed the bull by the horns, and he's gotten into meditation and mindfulness, and he's picked up cycling, and he's on a low dose of something to help from a blood pressure standpoint because he does have a family history of hypertension, but his quality of life is huge. And then he looked at me and said, well, how much are you biking now? And so
Nice.
I had to say, well, the trail got closed because of the construction and I haven't been out.
Excuses.
Exactly. I've got two literally both bikes have flat tires right now.
And 3 little children at home.
Yes,
and everything
very much
else.
so.
Yes.
No, but it was so rewarding to see how a
wonderful.
patient who could have a good conversation and then change their life. The other was another individual who love this patient who had been experiencing some cognitive delay and cognitive challenges. And we sat down and started to write out all of the potential things and came to basically alcohol that this person was consuming excessively because of the stress, because of challenges, etc. And as she has significantly reduced the quantity, in fact, she's now sober. This really was a problem for her. She's passed 2 years now of sobriety, and 90% of what she was dealing with dropped when she felt empowered enough to be able to take charge, see one of the potentials that was probably the largest challenge in her life, and address it. And it is so rewarding to see her interact with her family, to see her memory, sharpen, and to see her true personality come out. So and that was her. And I agree with discussion of this is the patient making the difference. I am just the assistant or the tool or the helper. And that's how I felt with this person. And I congratulate her every time I see her.
Love that. There's 2 thoughts I want to share on that, and then we'll wrap up today. And one is, I think we need to start a network of doctors who care. As you're telling these stories, I could sense how much you care about these people. And when you care about them and they can sense that, people want to make more changes, And the second one was the snowball effect. When people don't feel like they have control over one aspect of their life, it tends to spread. They tend to be stuck at jobs, relationships, all these sorts of things start to slip as well.
Yes.
And then once they change that, once we take control of one aspect, it tends to give us confidence to try another one. And it changes our entire life when we take little tiny action steps to change our health. And that's the cool part about what we do, is seeing people not just get feeling better. It's not just about a number, like blood pressure is XYZ. No, it's about how is this look in the whole picture? And when they change their whole life, the blood pressure may naturally come back down. It's really
exactly
cool.
Right. I think the only thing I would say to that is most of the physicians that I have the privilege of working with care deeply about their patients. The challenge with medicine is it doesn't often reward that. And so there are very big challenges that physicians, both medical doctors and osteopathic doctors and other doctors in the field of medicine who the system doesn't always promote that kind of empathy. And even though I firmly believe that just about every person that goes in to be a physician wants that, we do need some changes to our healthcare system if we're going to preserve that.
Maybe we need to go to a model of like, you pay me for how much you want me to care. So if you want me to care X, you pay this much. And if you only want me to care half that, then I pay. You get cheaper. So people come in, it's like, I don't really want you to care. I just want a pill. It's like $20. Have a nice day, kind of thing. So then we'd get paid more anyways. On that nice little laugh-like thought. Thanks again, Stephen, for being on the podcast today.
Happy to be
Always
here.
Great to chat with
Thanks,
you.
Jeremy.
Thank you guys all for listening in. This was another great episode of the Empowerful Health Podcast, and come back next week for a new one.
Thank you much.